So today we went to the Pregnancy Resource Center and we were hoping to go in and ask for resources with the premise that I'm late for my period and I need information about options. And because it's snowing so much outside, they closed. So there was a sign posted on the door, like the type of thing that someone typed out and printed, that said, like, due to inclement weather on November 15th, today, we're closed. And then it said, if you need immediate medical attention, call 911 or go to the Mellett emergency room. At first, I didn't think anything of it, but I think thinking through like a feminist lens, it very quickly became apparent that it was very deceptive because they present themselves as a medical clinic, which they are not, and as if they were open, they could have provided you with that care. But they can't. Like, they're not medical providers. They're not a real clinic. And even just posting that sign up there was like one of many ways that they are very deceptive to people coming in there.
Fake women's health centers, sometimes called crisis pregnancy centers, use shady tactics to deceive and prey on women. They advertise like doctors' offices. They look like real women's health centers. They brand their websites like real women's health centers. Their names often include words that make you think they're real women's health centers. They even open up next door to legitimate healthcare facilities and hire people to stand outside and lure women in. All of this hides their real agenda and ideology. They don't offer women accurate, honest, or comprehensive information about their healthcare options. In fact, they often risk women's health by delaying them from getting real medical attention, including prenatal care, and they even perform untested or unlicensed procedures. Anti-choice activists that support these fake women's health centers rely on deception to draw women in.
We want to look professional. We want to look businesslike. And yeah, we do kind of want to look medical. The best client you ever get is one that thinks they're walking into an abortion clinic. The ones that think you provide abortions.
My name is Pam. I'm a senior here at Penn State. I am majoring in biobehavioral health and women's gender and sexuality studies. My passion is reproductive justice, and that includes a lot of things. It includes activism, it includes educating other people, and it's basically around the idea that every person has the right to decide what happens to their body. It is our job to make sure that that right is respected and maintained. So in all of those arenas of sex ed, in abortion, in pregnancy, in motherhood, there are a million different ways that patriarchal institutions are trying to take away those choices and decisions, and it is my work and my passion to get them out of the way and maintain those rights. So I'm going in today to the Pregnancy Resource Clinic to talk to them about resources. I'm going in basically being like, I want to know about what's available for like pregnancy type of stuff, and then like eventually reveal, just like seeing how things go, that I'm late for my period, but I'm not ready to get a test. Basically I just want to get a feel for how they'll treat me, what they'll tell me, if they'll say anything about abortion, because like if it comes up, I think I'm gonna try to be like, so what happens if it comes back positive? I don't know what I'm gonna do. And just see what they say. I'm trying to do it in a way that like lets them lead, like give them a little bit of information, like enough to take it somewhere, and like wherever they go is what will give me the information. Like I don't want to go in being too informed, because I don't think most people that go in there are. So I'm trying to represent that. I'm really nervous for some reason, which is weird, because, like, I know that I have the right to information, and, like, I know that I have the right to get that. Like, I don't know why I'm so nervous, but I am. So, I guess that's also good, because that's how I really would feel if I was late on my period. So, here goes. It's not like the kind of anxiety where, like, I can't do it. It's the kind where, like, my heart is beating really fast.
But it's okay. We'll talk about it. It'll be good.
Hi, I was wondering if it would be possible to just, like, get some resources, like, information. Cause I'm late. And I just want to know what I can do. I haven't yet. I'm planning to later.
How about you take a seat and I can see if we have someone available who may be able to chat with you for a bit.
Okay, that'll be great. Thank you.
So I'm just going to ask you some questions so we can kind of figure out, has it been over 10 days since you had intercourse or like may have conceived?
Yeah.
Okay. Yeah. And how late are you for your period?
About a week late. Okay, it's like later than I normally am.
Okay. And did you want to do a pregnancy test here?
Do I have to do it today?
If we were going to take you back for an appointment and like give you resources and stuff, we would do a test.
Okay. Would I be able to get like brochures or anything and make like schedule an appointment? Cause I'm just like not sure how much time I have this afternoon.
Okay.
And I could like schedule it for like this week or next week.
Okay. Yeah, I can just give you like some pamphlets and stuff we have. Can you kind of let me know like what you're looking for in terms of resources?
Yeah. Well, I just like wasn't sure what was available. Like I've seen the flyers and stuff for this clinic around. Yeah, like testing, but basically I'm wondering like if it does come back positive, what is available to me.
Yeah. So at PRC we don't refer for or provide abortions here, but we do abortion education. So that's kind of part of the appointment. We would walk you through. I don't know if that's what you would be leaning towards, or we'd walk you through, you know, what different procedures look like, dependent on how far along you would be. We also offer free ultrasound, which is how women determine how far along they are. You know, we can guess by your period, but those dates fluctuate. So based on measurements in an ultrasound, I was encouraged. That's kind of an important piece of the puzzle to figure out. And then we can walk through, you know, the education behind each piece of it. And some women find it helpful to, you know, talk about what that'll look like, how to advocate for yourself. And we also have like other resources for parenting or adoption. I don't know if any of those things would be helpful.
Yeah. Okay. It does sound helpful.
Okay.
Can I schedule something like next week?
Absolutely.
And do like all of that.
Yeah, okay, absolutely. Yeah, let me come around to the window and we can take a look at your schedule.
Okay.
I walked into the clinic, and when I got in, basically it looks like a regular doctor's office. It's just like a lobby, and then a front desk or like a receptionist desk with like the glass door type of thing. And it's not a doctor's office, but it looks like one. So I asked the person working for resources because I am late for my period and I want to know what's available to me. And then eventually she came around and sat next to me in the lobby. So I was in the waiting room. There was one other, I hesitate to call them patients because it's not a medical facility, so we'll call them a person, one other person there. And then me and this woman who's explaining stuff to me. And I also thought it was really strange because we were having this conversation about when my last period was and the last time I had intercourse and all of this in a waiting room. Like, there was like no effort made for privacy. The person from the PRC that was talking to me said that she would give me information, but she didn't. And so when I was scheduling my appointment at like the counter, there was like brochures and pamphlets, and I just picked one up that I saw in that moment that said like what to do if you're pregnant. But I also thought it was a little bit strange that she didn't have like any literature to give me about what they offer, what they do. It's not professional. Like, I think that they make every effort to seem professional, but I think that at the end of the day, they're not. Like, they have, like, slip-ups that, like, you could very easily miss these things. Like, if I didn't go in knowing what to expect, like, knowing that it's unprofessional to be talking with a patient about, like, their sex life, or that, like, it's unprofessional to not have literature or to assess a patient's needs and provide them with that, or, like, the language even that she used. Like, we don't refer, we don't provide abortions. Like, that's, like, a very roundabout way of saying that you're anti-choice. Like, if I didn't know all of this, I wouldn't have caught any of those parts as a non-medical facility or as a facility that was going to, like, severely limit my options. Like, I only know this because I've worked in a healthcare setting and because I'm, like, pretty well informed on these topics. But overall, I definitely think that it was unprofessional without being obvious. I mean, maybe it was knowing that it's, like, technically a religious organization and knowing that, like, taking me back to feelings of being a child in those types of institutions, like, feeling small and feeling like I'm in trouble and feeling guilty and feeling ashamed. And I mean, it is similar to, like, when I was in Sunday school and the people teaching Sunday school are very nice people, with good intentions, thinking that what they were doing is right. And meanwhile saying abortion is wrong. So that, like, cognitive confusion of, like, this is wrong, like, I think it's wrong, but you have all this power over me and you seem like a really nice person, so, like, this doesn't make any sense to me. That feeling of when I was, like, 12 and learning about that in Sunday school transfers over to being 22 and going and just wanting information about pregnancy and them being pretty nice to me, seeming like a pretty good place, but also knowing that, like, what they were saying didn't make sense. I just felt, like, really small and unimportant and stressed out and lost. Like, I just felt dumb. It was just overall such a shitty experience. And it was from the start of when I started recording to when it ended, that was 10 minutes. Like, almost exactly. So that was 10 minutes of time. And in that 10 minutes, I, like, went from feeling, like, confident and informed and knowing what I deserved to feeling, like, shaky. And I kind of, like, wanted to cry a little bit just because it was, like, it was overwhelming. Just hearing it, I didn't realize that I could be knocked down so easily. Like, I think of myself as a pretty resilient person. Like, I've dealt with hard things, I've dealt with crises, and gotten through to the other side, but something about being there just, like, brought me down, like, 10 levels, which I didn't expect.
If this is a medical emergency, please hang up and dial 911 or go to the nearest emergency room. To book an appointment online and to learn more about our services, locations, and hours, please go to ppkeystone.org. That's www.ppkeystone.org. If you would like to schedule an appointment by phone, or you are a Planned Parenthood patient with a non-emergency medical question, please press 2. Did you know you can now schedule most appointments online? Please visit us at www.plannedparenthood.org and schedule with the center of your choice. That's www.plannedparenthood.org to schedule most appointments online. Your representative will be with you as soon as possible. Thank you so much for your patience.
The current hold time is longer than 10 minutes.
They put me on hold. So, in terms of my relationship with women's health and reproductive health, I came into college with a totally different mindset. As a freshman, I don't think that I thought that I'd be doing this. So, as a freshman, I took a women's studies course just as an elective. Yeah, after that point, I was like, I'm totally interested in this, and I want to learn more. So I invested the rest of my academic time at Penn State to understanding feminism and women's studies and gender and sexuality. So then the next semester, I took a course with Jill Wood, and that completely changed everything. I learned a lot in that class with Jill about reproduction. I learned a lot about abortion, birth control from so many different perspectives, pregnancy and childbirth, midwifery, the medicalization of childbirth in the U.S. What stood out to me was that there are so many barriers that women have to face to go through to just get basic care, and for people to acknowledge and understand what they're experiencing is really difficult.
Thank you for calling Planned Parenthood. This is again. How may I help you?
Hi, how are you?
Fine, and you?
Good. I'm just calling because I'm a student at Penn State, and I was just concerned about missing my period, and I was wondering if there were any resources that you could provide me with, just so I could explore my options.
So you said you missed your period?
Yeah, so I'm just a few days late.
Okay. So, we do have what we call options counseling.
Sure.
That you can come in for and speak with someone about different options. If you are pregnant.
Okay.
They'll go over all your different options with you.
Okay. And do you know of any other resources that would be closer to? Because I know Harrisburg is the closest Planned Parenthood to State College. So I was just wondering if you recommended any resources closer, because it wouldn't be necessarily an option to get to Harrisburg, just an immediate resource if you have any.
Let me see. What's your zip code from where you want to?
It's 16802.
That's the closest anything that's coming up is the Harrisburg location.
Right.
It doesn't look like it has anything.
Right. So are there any online resources? Can I get some more information on?
Have you tried the Planned Parenthood website?
I briefly, but I haven't really navigated through the entire website, but I guess that's something that I can do.
On the website, it's things that you can read about. If you click on abortion care, you can select more. They'll tell you information about like the abortion pills and things like that. There's a bunch of stuff that you can click on.
Right.
To read up on.
Okay.
You can't quite make it into the center just yet.
Right.
And then
Okay. And can I? Right. Yeah. So can I schedule an appointment online for your center?
Yes, you can schedule an appointment online, or you can give us a call and we can help you.
Okay. Awesome. Thank you so much. I'm gonna look through the website, and then see when I'm able to make it to Harrisburg if necessary.
Okay.
All right. Thank you so much.
You're welcome. Sorry about that. Have a good day.
No, it's okay. You too. Bye.
Thank you. Bye-bye.
Wow.
Oh, the conversation with that woman, you can just tell in her voice that she really, really, really wanted to help me. But there was nothing that she could do in that particular moment. And while it's upsetting, okay, we have work to do. And nothing will change unless I do the work and unless, the people I know do the work and you do the work. Yeah, but a lot of times I'm drained. I can't keep doing this. But then, I have phone calls like this where it's sorry, I can't help you because, there's just nothing I can do. And I can't help you because there aren't any resources near you. It's okay. This is why I do the work that I do. Because I know that there are women in real life who have to make those phone calls. Reproductive health is not easy to talk about. Nor is it easy to learn about. Because it's so real to a lot of people. And some people just don't get that. Particularly men. And how your reproductive health shapes the course of your life, because I think that it does, in terms of, sexuality, identity, sexual agency, just flat out understanding what's going on with your body. It's hard. And as an educator and as someone who identifies as a feminist and an activist, it hurts knowing that people don't have these resources, especially here in a college town where I know accidents happen or people become pregnant and don't have those resources, because this is what we work to, change. And I think doing this work is really, really tough because so many times you feel like you're pushing forward, but then you have to you get knocked down and you have to, take 2 steps back for so many different reasons. But I also think that, it's okay, gotta pick yourself up and you have to keep working because this is real. And nothing will change unless you do the work. I don't think that most people in state college know about this. And I don't think that it's fair that you have to know about it before you need care. I think in a more just society, we would have abortion clinics, and if you needed one, you would be able to go get one. You wouldn't have to be is this real or is this fake? Or go and not realize it's fake, and then realize it's fake a month later, and then it's too late. You shouldn't have to navigate all of that. This has such a profound effect on not only women, but everyone. And, people need to recognize that. This is not just something that you could just, brush away, or
it affects our daily lives as women in this world. We're just not doing enough. Like, especially right now. Like, what is going on in the world right now is not okay. And I think it takes a lot of education, but it also takes a lot of self-work. You know, recognizing your own struggles and your own experiences and how that plays into the larger, you know, political and social climate of our time, and recognize that, like, hey, it's not just you. It's a lot of people. But that work is really hard.
I don't think that people will know, or I don't think that people will really understand how just terrible all of this is, how hard it is, what this feels like, and why it's not okay, unless we tell stories. And I think that film, and in particular this documentary, is a way of saying, look, this isn't right and you deserve better.